Stuart Lamont from Kooringal Stud him and Penny have been really instrumental in setting up what we started as the Riverina Thoroughbred Breeders Stud Day. It grew really nicely. Then COVID came and did what COVID did and scuppered it. And we were going to continue again this year, and then we were going to stop, and then we were going to start, and then we came to this plan. So I'll let Stuart take over from there.
Thanks, Alan, and welcome everybody. And mainly on behalf of Thoroughbred Breeders New South Wales, and of course CSU and Alan and everybody else's input into this. It's much more Alan that actually organises. It's much more than us, Mr. Happy, as you can see. And so look, we're really looking forward to what the presentation today. We'll try and make it as interactive as we can. Please feel free to ask questions as the presenters are going. I'm sure they'll be thrilled to get lots of questions and throw a few curly ones at them, and let's all sit back and enjoy this session. So thank you all for attending, and we look forward to a good couple of hours.
Firstly, I guess I wanted to thank you for the opportunity to speak. And I struggled with my topic a little bit. It's a little bit long, I thought. So I kind of settled on possibly that picture, summing it all up, really, just having a quick look at what we might choose to get hung up about. So just to give you an overview, I am conscious that I struggle to keep to time. Thanks, Vicky. So I thought what we'd do is have a little look at the transition period and what red flags would suggest to you that you've got a reason to get hung up. So what to expect and what to look for, which is probably stuff that's very familiar to you. It's particularly common conditions, but hopefully I'll intersperse that with some new information from some of the work that we've been doing here. And obviously this is important because we have a need to think about treatment costs versus outcomes. And, compared to other veterinary species and even compared to people, we usually have athletic function as a non-negotiable part of our outcome expectations. So as you know, parturition in the mare progresses rapidly and still, and Alan and perhaps some of you might want to contradict me, but as far as I'm aware, we've not achieved any way of hastening fetal maturation. So in cattle and other species, we can do quite a lot to make the calf develop in utero so that it's ready for birth around our terms. That's still not the case for mare. And this website that I've plugged before is still available if you want to have a look at the inside view of what's going on in the late term mare. Of course, when the foal comes out, we've got this time of pretty rapid transition because being prey species, foals are not served well by communicating that they're doing poorly. So they're not going to telegraph that to us, and we need to be watching out for things going well for them. And the changes that are happening, obviously they need to use their lungs, which was not the case when they were in utero. They need to be able to keep themselves warm and keep themselves fed. They need to be able to stand, walk, and run rapidly to keep up with the rest of the herd. And there are infectious challenges on the outside that weren't there in utero. So normal neonatal behaviour, hopefully you're seeing this initial first minute or so after birth from a distance, because I think you would probably all agree with me that it's unnecessary and unwise to get up too close and personal in the immediate postpartum period. But then when it is appropriate to get up close and personal with the mare and foal, we've got quite a broad range of appropriate heart rate there. And respiratory function should sort of settle down within the first hour or so. And if you're really motivated by putting numbers together, I can show you an APGAR score, but a lot that's really important is just your experienced eye in terms of recognizing deviations from normal respiratory character in this example, or other changes, deviations from normal. If you do want to put numbers on parameters, a big score is good news. So this is an APGAR score that's been adapted from human neonates. And obviously the foal that's doing poorly in the immediate postpartum period is going to score not well. And again, just emphasizing these behavioral things. So, how quickly do they become sternal? I mean, it should actually be often when their legs are still not outside the mare. attempting to stand within the first half hour and on their feet by an hour after birth, nursing within a few hours. And obviously that seems like an eternity when it's the middle of the night and you've got other things to do, like getting back to bed or getting onto other horses. Passing meconium, I think 30 minutes is a bit generous, but looking for urination, surprisingly a long time after birth. Suckle reflex should be there early, and just looking for evidence of scleral congestion or hemorrhage or any other markers that the foal's had a rough passage to the outside world. And again, this is material I've presented previously, but it still, I think, has the greatest impact on foal survival. Just being able to recognize very clearly the high-risk foal from the low-risk foal. And we need to look at the foal factors that I've covered quickly then, but also thinking about environmental and other factors. So anything that's wrong with the foaling environment, so abnormally hot or cold days, abnormally wet, high stocking density, grass cover or general paddock hygiene. I mean, this is probably a little bit too crowded. Feeding practices, like whether you're feeding out on the ground next to fecal pats and things like that. Anything that goes wrong in the mare, so abnormally short or long gestation, pre-lactation, prolactation, or agalactia. Recognized presence of placentitis or a history of placentitis, and then any other changes that are common sense, really. Anything wrong with the actual active stage of labour, so stage 2 of greater than 20 or 30 minutes, you really need to be looking at that foal a little bit more closely, and obviously a red bag delivery, again, really cause for concern. And then I think we've been over foal factors, so any of the above previously covered and anything listed here, some more obvious than others, shall we say. If you've got a foal that has been delivered appropriately after an appropriate gestation and met all those behavioural benchmarks, then you're probably going to be able to step back and look from a distance. And from an insurance perspective, you may still want to demonstrate adequate IgG status. The high risk or the sick foal, just that reminder to get up closer and more personally and start looking with seeing eyes, I guess, at what's going on, bearing in mind that the foal's not going to communicate with you that they're in trouble, unless they're really in trouble. The most common neonatal problems, well, we tend to think of sepsis first, second, and forever. So any foal that you think is not doing well, I think you have to assume is septic until proven otherwise. And that's simply because we don't have the opportunity to sit back and wonder. If we treat early and aggressively, we get better results. But that doesn't excuse indiscriminate or inappropriate antimicrobial use. And we're lucky, we tend to, when foals come into us, they're usually pretty crooks. So we're putting catheters in as an aseptic process, and we've got sterile gloves on. And we'll collect a sample always for bacterial culture to tell us if the foal is septicemic. And one of the projects that we've had with AgriFutures has been review of all our bacterial isolates and sensitivities over the last 10 years. That's been through us. We've included some of the private practices locally and some samples from University of Adelaide. So that's given us over 1,000 isolates. And it's a little bit concerning when we look at the data. It does give us a basis for historical selection of antimicrobials. It does also give us a little bit of a worry in terms of now we're seeing 1 in 2 organisms as multi-drug resistant. So the emergence of resistant bacteria, I guess, is a big worry for us. We can filter this list just to look at isolates from foal blood cultures. And so we've got only 92 of those, and not all of them get tested because if the foal's died by the time the bacteria grow, the lab doesn't put it through. But as you can see, that sort of gives us a good basis for selection of antimicrobials. We can do the same with synovial fluid samples. And again, slightly fewer drug-resistant organisms out of foals than we're seeing from the general population. Of concern, though, is if we start looking at our isolates by species, you can see that Enterococcus is one of our more common gram-positive isolates, and these suckers are really hard to kill. So, 4 out of 5 is going to be multi-drug resistant, and a lot of the drugs that you're using routinely are not going to get these guys. So this is why we do have concerns about antimicrobial resistance. Certainly from a study that I'll hopefully get a chance to look at before we finish, using antimicrobials just in case is not wise. So we do have data to suggest that indiscriminate antimicrobial use is associated with increased morbidity and deaths due to septic disease. So we don't want to use them just in case, we want to use them well. And that means using historic antimicrobial sensitivity results to guide your initial choice. So have a chat to your vet and select a rational first-line antimicrobial drug or drug combination for initial treatment of septic foals, and identify a next choice treatment. And ideally, that's going to be based on culture and sensitivity so that you know your second choice is going to be effective. This is a bit too busy to take in, but just to show you this concept of where we've got resistance emerging. This is 10-year composite data for all our streps. You can see they're still sensitive to all the penicillins and were never sensitive to some of these other agents. Enterococci have always been difficult to manage, but see down here with staph, whereas in the first 5 years that we're in operation, we seem to have a relatively good hit rate with lots of agents that would be relatively successful. But red is bad, obviously. We're starting to see more of these red cells emerging over the last 5 years, which is consistent with results from around the world. And this just is part of a global initiative. And if we're not motivated to do this for our horses, then just the awareness that this relationship between bacteria that our horses harbour and human disease is really important, because if we're selecting for resistance in our horses, then chances are that we will have some of those resistant bacteria ourselves. And certainly there's data to suggest that horse vets in particular are at risk in this way. Other common problems, well, failure of passive transfer of immunity. So inadequate colostral transfer, either because the mare ran milk or the foal was unwell and unable to ingest or absorb colostrum. And again, data that I'll talk to you about later shows that being aggressive and ensuring that we provide our foals with adequate passive immunity is going to predict for performance. Or dysmaturity or intrauterine growth retardation, so small foals, floppy legs, dishy faces, silky hair coats. Dummy foals, this is an interesting condition. So obviously something that you're probably aware of. You get the odd foal that's just not playing with a full deck and just can't keep up and needs the mare to push it around a bit, or we can help with that. We do tend to think of these foals as presenting primarily with neurological signs. So here's a little guy that's just not quite right and exhibiting these behavioural aberrations. These are probably actually petite mal, so expressions of seizure activity. You can see that we've got more obvious seizure activity with this guy here. I should shut the sound off on those. So we do think about these as being mostly head problems, but they will affect other kidneys, gastrointestinal tract, metabolic, endocrine, cardiovascular, respiratory systems. So neonatal isoerythrolysis, obviously when the foal ingests colostrum, which has antibodies directed against its own red cells. This is a problem that you may have seen, probably decent sized studs, you'll get one of these a year, although there are ways of screening for it that we can discuss. Meconium retention, my pet theory on this is that these guys actually are giving a manifestation of GI maladaptation, and I tend to be a little bit more circumspect with any foal with meconium retention and just keep a closer eye on them, sort of move them towards the high risk category. Patent urachus, obviously the foal that urinates through its umbilicus. Again, this is an indication that the foal is not doing as well as we would like. Orthopedic problems I'll come back to because they're important. And then just this overview that we need to have a pretty clear indication or expectation of when these problems are going to occur. And obviously we can recognise at the time of birth some of these peripartum problems. So a prem or a dysmature foal is going to be readily apparent to us. A foal that's had peripartum asphyxia or needs resuscitation at birth should be relatively well apparent to you, and you guys are probably good at resuscitating foals, get more opportunity than we do. Meconium staining is going to be recognizable at birth. And then we've got these other conditions that actually sneak up on us in the first, sort of 12, 24 hours. So keeping an eye for the development of these, and even, congenital abnormalities, they're from birth by definition, but often we're a little bit slow to recognize them for obvious reasons. And then we get other problems that develop sequentially as the foal gets older. Sepsis can be a problem, as I said, at any point during the neonatal period. And I just wanted to spend a little bit of time just going over these couple of conditions, just in case anyone is not aware, because they're quite consequential. So herpes virus 1 is a cause obviously well known to you of abortion, stillbirth, and unviable neonates. Our lab has seen 3 or 4 aborted fetuses that have tested positive to EH3-1 this year. So they're sporadic, they're coming from individual locations rather than an abortion storm, but it is out there at the moment. And whether or not that gives us some, foals that are going to be born and survive poorly, we need to sort of be on the lookout for them. Obviously, this kind of lung pathology is not compatible with life, and a herpes, I don't know of anyone who's managed to keep a herpes foal alive. Chlamydia psittaci presents in not a dissimilar way, so it can cause fetal losses or placental problems. The important thing, the reason I'm emphasizing this is that our knowledge of it is growing over the last few years, and it is zoonotic. So it's certainly changed our way of handling these guys, and we now tend to put the PPE on until we have a negative swab for chlamydia. And we've learnt the hard way. We've had a number of staff and students hospitalised. And again, this causes pretty severe respiratory infection in foals. When we've looked at a case series of 15 foals from this area, Victoria and the Hunter Valley, 13 of the foals, only 2 of them survived. So high mortality because of, again, lost my mouse, there's really nasty pulmonary and liver lesions, lung and liver lesions. The other thing I think with chlamydia is that we need to be treating this with antibiotics that are not part of our routine selection. So it is a matter of sort of being on the lookout for this because the pangent reflex or whatever it is that you'd be using first line is not going to be a good choice for these guys. So respiratory disease in foals is a point of interest for us. Nasal oxygen insufflation is the way that we tend to go by default. We have had a go at ventilating. This was a particularly valuable foal that ended up being positive to herpes, so not successful, but we've got it there on a ventilator, which, as you can see, is pretty labour intensive. Does every foal need respiratory support? Well, no, and I can talk to you a little bit about how we recognise that, because I think objective characterisation of respiratory function is something that challenges us quite a lot. The advances that we've made, I think, in the last few years have been looking at non-invasive ventilation. So this has revolutionised the way that human neonates are being managed, and there are plenty of papers to show that, I think particularly of interest to us, not putting these babies on a ventilator is associated with shorter hospitalisation and improved outcomes. It's also commonly used in the ICU, and with current COVID issues, any footage that you've seen of people with these helmets on, they're receiving non-invasive ventilation, can be used in ICU and other settings. And the other time that you might be aware of it is just if any of you are unfortunate enough to suffer from sleep apnea.
Sharanne, sorry, I'm just gonna give you a 3-minute warning and then a couple of questions, please. Okay, thanks.
So I'll finish with what we've done with non-invasive ventilation then. So we're using non-invasive ventilation with our foals. It tends to work by splinting the airways and keeping the air sacs open. So if you can imagine what it's like to blow up a balloon, hard at the beginning, easier as it gets, more air in it, and that's what we're trying to do with these air spaces and improving gas exchange that way. Skipping through, Our particular question was, could we use an off-the-shelf unit that wasn't going to be terribly expensive to achieve the desired outcomes? Long story short, we've looked at mask and nasal prong delivery. And what we're seeing is that the short answer is yes, we can improve oxygenation. We're now using a transport ventilator. So this is what the ambulance drivers would have if you're unfortunate enough to need one. And we've put foals through CT. I'll just turn the noise off. So going through CT, we can see that we're able to improve. Here we've got a lot of pulmonary congestion. With CPAP, or non-invasive ventilation, we're able to clear the lungs quite well. Some of the work that we've gone on to do more recently, though, has been to get rid of the mask and use nasal prongs, which I thought would be poorly tolerated by foals, but which the foals actually seem to manage quite well. And with the few intensive care cases that we've admitted, they're really tolerating the prongs well and actually breathing much better when we're able to support them with the ventilator. So is this something that you can do at home? Well, I think it's likely to be effective on farm. With the nasal prongs, we're not getting CO2 accumulation and we're not needing to hold the mask on their face as was the case previously. Monitoring response, though, is likely to be challenging. And what can I skip through to? I might just go right to the end. I did want to look at what you guys can do on farm versus in hospital. And I think the difference is that you're probably better than us at resuscitation because you're there on the spot more often. There's not a lot that we can do that you can't do on farm. It's just the difference is going to be the monitoring of the animal and the support that they're needing. So I think that's probably a reasonable time to stop. I do have some slides on bent legs because they emerged as the most common problem. And too fast for my computer. The other thing that I did want to, actually maybe I'll finish with this. The other thing that I think we need to be sensitive of is this is a study that I presented previously. In terms of the data on incidence of different disease conditions is perhaps not unfamiliar to you. Because of the delay on our end in publishing, we were able to look at how that the impact of disease in the 2013 cohort impacted earnings. So we had 500 odd standardbreds and 500 odd thoroughbreds in the study population, and we were able to track them through to their 5-year old racing career. Median earnings for standardbreds was less than $500. The thoroughbreds, $16,500. But we just need, I think, as vets to be aware of, what their earnings potential is, when we're talking about treatment options and perhaps look at what's affordable as well as what's appropriate. A few things to pick out from that. Assessment of colostrum, measurement of IgG was associated with better performance in that study population. Presence of bent legs was actually associated with an increased proportion of winners. So I think that was relating to people's appetite to pick problems. But septic disease or dummy foals was associated with a decreased performance potential. So I'll stop there. And if we have any questions, we're very welcome. I just wanted to acknowledge also the people that have been helping with foal projects. And there are some references, and there is also a booklet that we can make available to you that covers some of the stuff that I've run over quickly.
Excellent, Sharanne. Thank you. We've got a few minutes. Anyone want to have a bit of a stab at a question or back up or disagree with anything that Sharanne said? Don't hesitate to just unmute and speak. The antibiotics and COVID, I think this effects of animals and animals and humans has become very obvious in the last 18 months. So don't just use antibiotics routinely, I think is a very good point. And enterococcus, enterococcus, I think it is, bad news. Just about every single one. I haven't seen many, multiple bacteria resistant. I also agree that meconium retention, sorry, Sturt, meconium retention, I think is just a bit of an iceberg. It's an indicated disease, yeah. Sturt.
Thank you, Sharanne. That was terrific. Can we just touch on the benefits of plasma, particularly in cases where we do have some antibiotic resistance?
Yeah, look, I think we underestimate the value of plasma, and it's got multiple benefits. One is that it's going to, the obvious one is that it's going to boost the foal's immune status, and we measure that by measuring IgG, and then that gives us a big tick with the insurance companies. I think that's an oversimplification because there are lots of immune proteins that are present in plasma. Colostrum gives us even more bang for our buck if we can get it into the foal. It's got all sorts of trophic factors that will protect the gut. It's got cells from the mare that go to the foal. So it's better, but obviously there's a time limit and there has to be a well foal to absorb the colostrum for that to do good. So I think plasma is great. I think plasma also has merit when we're managing a septic or an intensive care foal. The limitation for me is cost. I mean, it's absurdly expensive.
Cool. I'm going to just keep moving, just in the interest of time. Sharanne, thank you very much. And I realize you do have something else to go and do, but I'm glad you keep hitting this colostrum and all these other factors that we talk about. It's been shown in other animals that epigenetic effects are typically positive as a result of the use of colostrum. So obviously, if we can use colostrum, but if they crook, we can't. Thank you, Sharanne. Next on is Victoria Brooks. She is a epidemiologist and now a fellow of the Royal College of Veterinary Surgeons. Well done, Vicky. Who's going to talk to us about her project that's dealing with making the most of a dead foal, I think it is. Thanks, Vix.
Very nice to see so many people on this morning. This is a little bit of a different style of presentation to the one that Sharanne just did. It's more about what we are doing in a research project for the thoroughbred industry, and it's funded by AgriFutures. So it's about the pathology and epidemiology of equine pregnancy loss. And I'll just go through the people that are involved. There's Joan Carrick. Many of you will know Joan well. She's a specialist in equine medicine in Scone and does a lot with pregnant mares and to prevent abortion. Angela Begg, some of you will also know Angela. She's a specialist veterinary pathologist based in Newcastle, and she has for over 20 years been looking at the gross pathology and histology associated with equine pregnancy loss. Mel Stewart is a specialist veterinary pathologist as well, and she is one of the key people on this project who's looking at all of the pathology side for us. Patrick Shearer, again, another specialist in veterinary pathology, based in Melbourne with IDEX. Jane Heller, who's a specialist epidemiologist based at CSU Wagga, and myself, also a specialist epidemiologist based now at Sydney. So we're quite a well-qualified team to be looking at this. Since we've been started this project in around about when COVID started, and because we're based all over the place, we are actually very good at Zoom anyway. So there's the team all together at the start of the project last year. So we meet every week, and over about 3 years, our project objectives are overall to have more of this top picture, and obviously less of this. That's basically the objective of this particular project. So how we're doing that, we're looking at a couple of different avenues. We want to overall prevent the pregnancy loss on farm and individual in mares. So we need to understand a little bit more about the risk factors for loss. What causes those individual mares to lose pregnancy? Some of them we know, such as infectious causes, such as chlamydia, but we don't know exactly how chlamydia happens to occur on some farms, or on other farms affects some mares, not other mares. So that's an example of the type of thing we're looking at. We're also wanting to detect and respond to outbreaks quicker to prevent further losses. So some of you will remember the outbreak of EAFL. I think it's at least a decade ago now. And we did know at the time that there had been cases earlier on, but because of the way the surveillance system works in the thoroughbred industry, there isn't really an overall system. Individual farms know what's going on, but the whole industry isn't together on that. We know that if we picked it up earlier, we might be able to prevent further losses. So we want to improve the reporting and diagnosis and surveillance of pregnancy loss as well. So there's a chain of events, obviously, around pregnancy loss. It starts with somebody noticing a mare on the farm has lost a foal or there's discharge, and they phone up the vet. And the first stage would be a post-mortem of any material that can be collected from that abortion. That post-mortem, or there's a report produced which goes back to the farm for feedback, but material from that post-mortem goes on for laboratory testing. So this is what we call the gross pathology stage. And this next stage here, this is the histology or histopathology stage. So we'll put histo there. And again, there's another report, and that goes back to the farm. This project also adds in the data analysis phase here. So this is, the pathologists are obviously involved in stages 1 and 2 here, but the epidemiologists get busy at this stage looking at the reports that come through from the post-mortem laboratory testing to try and work out what happens over time and what happens spatially, you know, in different areas in Australia to understand those risk factors. So a little bit more about what the pathologists are doing. I was hoping I might be able to get Joan here this morning, but she's busy scanning mares. So let's just focus on these first 2 sections here in the orange box. Hold on. The pathologists are developing a post-mortem examination. So what they're really wanting to do is to enhance the diagnostic side of equine abortion. At the moment, many abortions, they don't end up having a final diagnosis, and sometimes that can be purely down to the post-mortem that's either done on farm or in the practice. And so Joan is busy training vets and developing a manual to outline a protocol for a complete fetal post-mortem examination, so you're more likely to get a diagnosis. And actually training the vets to do the post-mortem and collect the samples. And we're hoping that over time, this will be, these manuals will be refined so much that John will need to run fewer and fewer courses. So you won't, for example, have to be in the Hunter Valley to learn how to do this as a vet. This is an example of some of the pages from the manual there. So it's going to be very visual, lots of pictures, descriptions of how to actually do the post-mortem and how to recognise what you're seeing on that post-mortem and how to describe it in a report that you then send with the little bits and pieces to the pathologist on the next section. So the laboratory testing, this is where Mel Sturt is very, very much involved. So over the last 10 years or so, Vetnostics with Angela have collected over 400 specimens from over 400 equine abortion cases. And so Mel has been going through all of those and basically downloading Angela's brain. She's been looking at all of the slides, describing what she sees, how they're associated with the different types of abortion, and going through all of that with Angela, and also the gross pathology, so with Joan as well. And they're developing this visual atlas will be full of really pretty histology pictures like that, but also very useful diagrams, schematic diagrams like this. And this is to train pathologists. So at the moment we have very few pathologists in Australia who have the level, even the specialist ones, within the specialty of pathology. Reproduction is still another specialty. So it's really to expand the group of people that can give good diagnoses around equine pregnancy loss. So then what are the epidemiologists doing? Well, this is my department here, looking at computers most of the time. So we're focusing on this box here, the data analysis side. And obviously I've said already, we want to identify risk factors. One of the ways we do that is we simply compare mares who have had abortion with mares who haven't had abortion. And that helps us identify mare pathogen and environmental risk factors. So for example, mare factors might be the age, the stallion that they were sent to. There might be differences in the causes, such as chlamydia, and then differences in the environment, such as the paddock and the weather. So if we found that there's sort of environmental differences, we can then dig a bit further and look at, well, what are those environmental differences? Which is how they got to the bottom of EAFL. They knew there they were seeing pathology. So we're putting our data with the pathology data. So they were seeing the caterpillar CT in the pathology in the mares and the foals, and then looking at how that was happening in the environment, the types of trees, the types of caterpillars that was associated with. And then the other part of epidemiology is developing a surveillance system. Now, this is very much a bigger picture part of this project. The first important thing is to develop a baseline from the annual patterns of abortion. And then we can use that baseline to say, okay, well, this is what used to happen. We expect it to carry on happening like that. So here's a picture of the Hunter Valley area with abortion cases over the last 5 years or so, and the darker spots have more cases. And then this is a trend line over time, a temporal plot here, which shows us that, you know, we can actually see on this that, as you would expect, that we see an increase in abortion and then a decrease every year and a nice standard pattern. And then probably we'd expect this blue line to be pretty much a straight line over time. And so if we start seeing changes, like we start seeing something odd happening here, for example, like that, coming up, then we would recognize that there was something wrong. So by getting this data, we've got the old data. By getting new data, we can continue to predict what should happen over time and in space. And if we get something like a sudden increase like this here, or a big hotspot there, then that will automatically ring an alarm within our computer system. And then that can go on and be investigated sooner than it would do otherwise. That's big picture. At the moment, we are, whoops, let me just bring those back. At the moment, we're very much at this stage and developing the baseline. How are we doing on time? Not bad. So how can farms help with this? So we're moving into what we call the phase 2 of the project. And if you want more information about this, then please, if you're in the Hunter Valley, contact Joan Carrick. If you're in this region, contact, probably the easiest thing. I think everybody's got Alan's email, and he can forward them on to me. Or I think, are they on the handout, Alan? They might be on the handout. So how can farms help? We are going to be enrolling farms to collect abortion material for diagnosis for gross pathology and histopathology over the next 18 months or so. And again, that's being funded by AgriFutures. And that's giving the vets in different regions the opportunity to get trained in how to do it, and also new pathologists to start using those manuals for diagnosis as well. And it helps the epidemiology side because we get more data, so we can understand that baseline better, and we can look into risk factors in more detail.
I've got a question here in regards to the statistics that they're getting. Are they coming through the stud book? Are these the studs that are actually notifying you guys with the abortion rates, or how are you finding this information?
Okay, so yeah, at phase 1, we're using retrospective data. So that's data that's already existing through the records from the Hunter Valley and Vetnostics. So veterinary records for those. And then as we're moving into this next year, we want to actually get data from the studs. So we're going to be contacting quite a few of the studs and hoping for participation from as many as possible, actually, to let us know. We're obviously very familiar with the industry and understand completely that not all mares will be investigated, but we need data about just abortions, even if they're not investigated as well, just to get a background level of how much is occurring.
And this is only in the Hunter Valley for the moment, is it, as opposed to statewide?
It's going to be Hunter Valley, South Queensland, Victoria, and potentially a little bit around the Riverina area as well. Yeah.
Thank you. Is the stud book involved at all with that as well, or not?
No, the stud book isn't involved. No, not at this stage. So we can use that. We have got some stud book data. So if we need to look at the history of specific mares, we can see, okay, when we're looking at risk factors, a risk factor of interest might be their previous breeding history. And so we can get a broad view of that from the stud book. But apart from that, no.
Vix, thanks very much. It's a really interesting project. As a theriogenologist, it's one of those things we're always trying to find. And as you mentioned, things like EAFL, we didn't really know what EAFL was until it happened. Fortunately for us, I think that we had MRLS, so the male reproductive loss syndrome in the States, to give us a little bit of a clue. But we still had to work these all out. So yeah, so something that was obviously occurring all the time, then became a big problem when whatever changed, and that's what happened. And I guess the same with chlamydia.
That's right. Yeah, these things have probably been around for a long, long time, but just sporadically, so we don't notice them. So what we're hoping to do is to pick up things earlier, basically. Yeah. Yeah,
and things like EHV that Sharanne alluded to as well. And EHV's been around since before horses were horses, I think. But the point is these pathogens change, and if one thing COVID's done, I guess, is it's made us more aware of the many changes that can happen and how we're all interlinked and we're part of it.
Yeah.
I think
cool.
the other thing that I was going to mention, Alan, too, is that, you know, Sturt probably raises a fairly good point with respect to the stud book. Probably mentions that there are a number of horses that will slip pregnancies throughout their gestation, but you know, the percentage of those that are actually investigated are reasonably low. So the more that we can investigate, the more we can start to understand some of these disease processes, but also treat them as appropriately in subsequent pregnancies, rather than making assumptions as to why they may have lost their pregnancies.
Yeah, I think that's a very valid point, Jen, that we so many times, why did that happen? Well, I'm neither Harry Potter nor a crystal ball gazer, so we need to actually try and get data. And what Vicky's project is doing, or that whole team's project, is it's using data that's been collected by obviously a whole swag of experts to then try and feed back, to give information back to the industry, which is just, it's just a fantastic project.
Yeah, and you have to, it won't be perfect to start with. You know, these things always have to be built. And we completely understand that, you know, there are certain periods where it's easier to pick up abortion in a mare. Those mid to late gestation periods are obviously easier. It's more visible. But hopefully as this project goes on, we'll be able to start to understand, we'll get enough data of less common scenarios and be able to understand a little bit about those as well.
And whilst this is being sponsored by the thoroughbreds, and there's a lot of thoroughbred interest, obviously, for it, this is not restricted to that. This is horses and horse breeding, and from my point of view, I certainly want to make that fairly obvious that we're not restricting it to anyone in particular. Even though we thank the thoroughbreds and the thoroughbred people for the base of it, it's not a restricted or specialist niche audience. It's to anyone who's interested in breeding horses. Cool. Well, it's quite good to see some old faces. I don't want to say old faces too much because I haven't seen them, but people like Jade to catch up again. I see Wendy's on. Rachel, good to have you on as well. So this will be old hat for you guys. I'm going to come here and I try and be a little bit controversial. So that's what my aim is. Not necessarily to be particularly controversial, but I want to put some different thoughts out there, because we don't want to necessarily keep doing the same thing all of the time. So I'm going to crack on next, and then Jen's going to finish up, and then we're going to be happy to take questions thereafter. I don't really want to do too much talking myself. I'd rather you guys did the questions and then spoke to me, and then we had a conversation. So please don't hesitate to jump on. It's not always that easy on Zoom, but often when you unmute or put your hand up or just talk, and I'll see your thing light up. So what we're doing is basically we wanted to talk about preparation for the breeding season. And I think it's really important, as we alluded to at the beginning, that we get all excited about the breeding season, because by the time November comes and it's hot and there's flies and the Melbourne Cup's over and we haven't finished all that we thought we should have done by Christmas, it starts to get rather become a bit of a drag. But if we can start with enthusiasm, then we can look forward to the next session. I don't know why my thing's not moving on. So that's me. So that's what the aim of this is to do, is kind of preparation. Just a little reminder, everyone knows this, but just a little reminder that mares are seasonally polyestrous, so they tend to cycle in this bit here in the main phase, and then they go into an anestrus phase. 80% of mares, remember there's 20 that are going to probably go through that without and still be cycling. But by definition, then we've got to have 2 transition periods, and we forget about this transition period when we're going into anestrus. But this transition period here, which is different from the transition period that Sharanne was talking about, when a foal goes from being a fish to being a breeding animal, so from in the uterus to being on land. This is our transition here, and if there's any dairy farmers there, think of transition as something different when they go from not producing milk to producing milk. So interesting thing, transition. And then just a little reminder that we have an estrus period, and then we have a diestrus period effectively, and then this little period in between where we have an unresponsive corpus luteum after ovulation. I put 4 days there, some people 5, but there's a period of time where it's not responsive to administration of prostaglandin. And just a reminder, some people get sick when they see this, but I find this really exciting. This kind of cycle that happens, the estrus cycle, where we end up, once the animals actually started cycling, so we've gone through transition, going through the brain, the hypothalamus, and the reproductive organs, and how all these hormones kind of act on each other to induce the state of estrus, and then that's when we're going to be wanting to hopefully breed them. In the thoroughbred industry, I think we've mentioned this slightly earlier, trying to get early foals is apparently one of the aims. It also, I guess, the big benefit is it means we can have Christmas without foaling. That's probably, from my view, the best point of view. So we try and get them to cycle early. How does it happen? I'm sure you're all aware of this, but if you're not, it's as effective as it's multifactorial, but the single most important factor, if you are going to talk about it, is light. So the increase in day length is what affects the breeding period of horses. And nature's pretty smart. The reason why we use light rather than the amount of grass or the amount of rainfall, whatever it is because those can vary a tremendous amount. Whereas the length of the date of the 5th of August this year is going to be pretty much the same as the 5th of August next century, and it'll be pretty similar to what it was 100 years ago or even before that. So it makes it a much better fine-tuning system for nature to organize. This is the kind of pathway that it goes through, and I don't really want to dwell on it. I can always come back to it if you want, but it's the big thing to remember is it's a process. It starts off with light, increase in day length, and then it's a whole chain of events starts. And the reason why I mention that is I've heard too many times, and it still frustrates the living daylights out of me when people say, oh, well, we gave it 10 days of Regumate, gave it a PG, and she should be ready to serve on the 15th of September. And stud managers and veterinarians know only too well that that's not necessarily, well, it's not the case unless they were cycling or they were put under lights previously. So what do? We put them under lights. I guess this is almost old fashioned now when we put mares into a yard with lights on. We have to turn the lights on at the end of the day. So the effect of changing the transition isn't as beneficial if you turn the lights on early on in the morning. It's got to be at the end of add the light on at the end of the day to make a total of at least 14 and a half hours. But all those other benefits of keeping warm, stress-free, good food, all those also play into the chance of the animals starting to cycle earlier. And why I said it's kind of gone out of favor now, apparently a lot of places are using the Equiloom, which means you don't have to build yards. You can spend $500 and buy one of these things and put them on your horses, and then you can see their eye at night when you go through the paddock. And this is just some data from my late friend and colleague, David Hanlon, who did some work. And my question is here, why would you not use lights of any description if you're wanting to breed early? And the caveat there is that you want to breed early. And on this picture here, he's got a Kaplan-Meier survival curve, doesn't matter. It's just a graph that shows, this is the number of proportion of mares that were not pregnant. So these they were getting pregnant very quickly in this breeding season, early in the breeding season here when they're under lights. When they weren't given transition management, this is the difference, takes a long time. So within 30 days, more than 70% of them were pregnant in this cohort, in this study. Whereas here, it took us a lot longer, to 2.5 months before they ended up getting the same number pregnant. And that's reflected at the end of season pregnancy rate. And if you're selling foals or yearlings that are worth a lot of money, you can do the numbers yourself. And this table here just says the same thing. The main brief that Sturt had for me was to prepare for foaling, and that was because we were hoping to do this in July. I hope if you've got some foals on the ground, they're happy, healthy ones and didn't need to go and see Sharanne. But preparing for foaling or carrying out foaling is the biggest thing, is to be prepared. And I guess we're never completely prepared for the many eventualities that can occur. But if we start to think of them, at least we can get some of them out of the way. So we spend all this time getting what we're wanting to get our nice early yearling. We go through the teasing, breeding, eventually we want to make sure that we have a decent success with a foal. So it's the planning, it's preparing on the farm. And we had, from Vicky's talk as well, we had, we're losing foals as well. How do we try and decrease the chance of them losing foals? And if we've got equine herpes virus causing a problem potentially, how do we deal with equine herpes virus? Well, I'm going to be a bit controversial here, but I don't think it's controversial. We can use vaccination. So we go equine herpes virus vaccine, and then we get told we need to do it at months 5, 7, and 9. And then we get told maybe we should do it at 3 as well. And I look at it and go, if you have to give that many vaccines that frequently, I can't think of it being anything other than a shit vaccine. So I'm not saying vaccine doesn't play a part, but I can't see that it can be that important if you have to do it, administer them that frequently. You're far better off managing, keeping them in batches, not stressing them, all those other factors that are probably more important with equine herpes virus. Another thing, deworming. So I think deworming is really, really important, and we need to put that into the antimicrobial resistance package as well. Make sure we don't over deworm them. But as we start to come close to foaling, then I think we get into a more critical phase, and I think we need to be more proactive in deworming rather than those while they're developing their fetuses, because deworming the nearly parturient mare is probably really important for the worming control of the foal as well. Hoof care is one of my favorite bugbears. So many times you see these, oh, this is a really valuable mare, and she hasn't had her feet trimmed for 3 months. You go, really? Well, why don't you pay someone $100 or whatever it is to do her feet? Because she's got to carry everything around on those feet, and then the effects of laminitis, etc., and breeding laminitic mares. And I'm not going to go there. Vaccinations, I've spoken a little bit about herpes virus. Strangles, I'm almost a little bit about strangles. We can do what we can do, but certainly we should be making sure there's a tetanus vaccine. They're vaccinated for tetanus, sorry. 2 years ago, this seminar before COVID came along was all Hendra virus. We'd had the Hendra virus detection at near Gundy, and there was this huge big Hendra virus awareness. We mustn't forget that Hendra virus is going to be with us just like probably coronavirus is going to be, and to make sure that we deal with it appropriately. And there was big talk about whether things should be vaccinated or not, because if they went onto various markets and the like. But I just put this one out there again, just to remember that Hendra virus is really, really important. Not so much for the horses, it's important for the horses as well, but it kills humans. And as a result of that, we need to make sure that we have really good biosecurity. Touching on to all those things, hoof care, deworming, antimicrobial resistance, vaccinations, making sure that when the mares come onto the farm, whenever that happens to be, whether it's just prior to foaling or whether they've been on it all year, that we keep them in there, that we try and keep, if any disease is going to come out, there's going to be any disease outbreak, that we keep it in as small a place as possible. So we either don't let it come in, or if it is coming in, we keep it in the same place. So that's our biosecurity. And I remember people talking about biosecurity, and an Irish friend of mine in Zimbabwe said, that's the Alsatian dog at the farm gate. Well, it's not really that. We are trying to remember that we're trying to stop diseases from occurring within our whatever enterprise it is, and those include weeds and other pests as well. Another part of the planning is making sure that we've got the right equipment and facilities, but most importantly, having good personnel. It's just vital. We all know that. And this is one of the reasons why Sturt pushed for us to continue with this program. And I thank him for that, because trying to keep staff aware of the potential problems that can occur, and then being able to be aware of what might happen so that they can do something proactive rather than entering panic mode, I think is very, very important. So keeping foaling staff and all the other support staff together as a team while we struggle through the foaling and then the breeding season is a very important part of stud work. We need to make sure that this, I like this picture. I think it was by mistake. There was 2 oxygen cylinders here. I think that's really important that we think of interventions that we can do that are going to be life-saving in a very short space of time. And oxygen is certainly one of them. And I think we'll touch on a little bit later. Otherwise, you can bring me back to it if you want. The other thing that I don't think we ever get right, but we should be trying to decrease the times that it doesn't occur correctly, is making sure we know what our referral procedure is going to be, whether that's for a sick foal, as Sharanne alluded to, or if it's for a foaling. And what are we going to be doing when we do the foaling? Are we going to do foaling on farm, and then if it doesn't work out, we euthanize? Personally, I don't have any problems with euthanasia as an endpoint, as long as it's done correctly and it's to end suffering. There's much better to euthanize than to not deal with something properly, in my view. It's a tough call. Whenever there's anything being born in any species, there's always a lot of emotional involvement, and we need to remember that when we're dealing with it. And so as stud managers or foal people, we need to know which mares that we move quickly on and those that we're not going to move quickly on just because of other factors out with just the normal foaling thing. And I don't know if anyone's got any comments that they want to make on that kind of preparing to get mares to give birth to the best of our ability. No, we're all happy with that. Cool. And remember, foaling's not, when you're out there, it's not everybody, somebody, or nobody. It's actually you that has to do it. And all these little things that kind of, as part of the planning process, is, you know, when you're going to have the mares foaling, do you have the 11-month rule, as well as looking at their bags? So if they don't have a developed udder, but they're at 330 or thereabouts days, then they need to come into the foaling paddock, because those can often end up surprising us and having the foal out in the paddock, or not having the foal in the paddock, and we find them in the paddock in the morning when it didn't, when what we wanted to find was 2 live ones, but we found 1 dead one with something inside it. And whether they bagged up, so whether the udders started to show signs, and if they are, I know we don't want to have the foaling area, observation area, too crowded, but we also don't want to miss any. That's the whole point of us being there. And all these other aids that we can use, like testing milk for pH and calcium, having alarms, and then making sure the caslick is open. So if we have got a caslick procedure, to make sure that it's open. It's not necessarily the end of the world. She will tear because that foal's big enough, but ideally we want it to be open. And I put induction in there as a little bit of a green thing, because just as a different color, I didn't want to make it red. There's some places that actually use induction really effectively. And I think something that we should probably think about doing, and where we can have foals born during the day. I don't know if anyone's got any thoughts about I'm hoping that's controversial enough that it'll get some talking, but it looks like everyone might be quiet.
What are some of them? What are some of the methods for induction, Alan?
So that's a really good point. Sharanne mentioned that we struggled to get foals to try and make foals get mature more effectively. There has been some work done in the past where they had to inject the foal through obviously more invasive means, and they would kind of research things to induce maturation. So that's not really a easily done management procedure. Another thing we can do is administer dexamethasone to try and increase the chance of the foal maturing, and some work just recently shows that that possibly does occur, but the cost benefit of that is probably debatable at the moment. The thing about induction, there's only one way that I'm aware of, and that's to use really low doses of oxytocin intravenously, but typically we need to know that that foal is ready to be born. So by measuring things like milk calcium or milk pH, and then using low doses of oxytocin. So the typical dose that's mentioned is something like 0.3 or 0.5 of a mil, or 3 to 5 international units. And what that's meant to do, and this was reported by people at Cornell, what that's meant to do is if you use 5 international units or between 3 and 5 international units of oxytocin, and the foal's not ready, even though there are other things that suggested it might be ready, she will not give birth. But if the foal is ready, then she will give birth at that dose of oxytocin. So it's important to remember that it's the same process that we're doing, we're just using a very low dose. If you gave her 1 mil or 10 international units, she might foal anyway, even if the foal wasn't ready to be born. Then we have all those problems that Sharanne was talking about. Does that make sense?
And that would be the difference between abortion and induction, Alan.
Yes, although you're absolutely right. That would be inducing abortion, although not necessarily. Yes, it would be. Yeah. So we don't want to abort them. We want to induce them. We want a live foal, not a dead foal. Absolutely. Thanks, Jen. So all this kind of planning stuff that all you guys know about, making sure you've got enough halters and torches, not just torches that work and torches that are nice and bright, and there's a spare torch, because somehow or other torches always seem to get lost, misdone, put in the wrong place, and then all of a sudden there's 3 mares foaling and we don't know where the other torches are. So torches, make sure they are. Baler twine, I guess my third world upbringing, you always have baler twine as part of your repertoire of something to assist you, because they can always be useful to do something, even if it's to tie the gate closed when there's 5 mares coming through. Identification sheets are really useful because you want to make sure that the right mare foals the right foal, and you put the right mare with the right foal, and so you don't end up with the problem at identification time when the DNA comes back and they're 2 different things. So you want to make sure of that. And the thoroughbred industry, certainly the horse industry, appears to be really good at documenting those things: mare, foal, what time it stood, all those kind of things, which are really, really useful. Sadly, we probably don't use enough of that information to go for the future, and that's where Vicky's project's really good. Other bits and pieces that we need: lube, gloves, ropes and chains, or a head snare. This kind of feeder-tome here, they can be useful if you want to just do something fairly simple. I don't know if there's any vets out there, but this kind of feeder-tome, I think, is nothing more than just a wee guide to stop the vulva and the vagina being abraded. If you want a proper feeder-tome, you need to get one, a Utrecht feeder-tome that's got a proper head on that. Otherwise, you can't do all the cuts that you should be doing. But that's a bit further, more complex than this. But having the right sort of things that you can have, whether you have ropes or chains, and people have their different preferences, and I don't have any problem with any of them. I have to say I like chains, and mostly because they are easier to find and they're much easier to keep clean than ropes. Has anyone got any comments or thoughts on ropes or chains? I'm talking about foaling, not in your own recreation time. No? Okay. So there's all these bits and pieces that we've spoken about. Disinfectant, we want to try and keep things as clean as possible. There's never seems to be enough buckets, and warm water is always a useful thing to have. PPE, as we alluded to and Sharanne mentioned, we should probably try and carry, whenever we're doing any foaling, especially if there's any problem, if there's a problem, it's more likely that there might be something else going on, such as chlamydia. And if we have the right kind of equipment on, we're less likely to have humans affected, and that's got to be good for all of us. We all know we've got to have lots of lube at parturition time. So to me, there's got to be at least 5+ something liters of lubricant. And the other thing I need to mention about lube, most of the time, obstetrical lube is what we call carboxymethyl cellulose. And the reason why carboxymethyl cellulose is quite useful is that it's a lubricant, but if there's a tear anywhere and it goes into the peritoneum or into the abdomen of the horse, it won't kill her. Whereas this J-lube or polyethylene polymer is a fantastic lubricant. You put a little bit on your hand and it just makes everything so slippery. But if any of that goes into the mare at any time, if she gets a tear or whatever it is, she is probably going to be a dead mare. So just bear that one in mind when you're getting lube. Most of the time we use the carboxymethyl cellulose. There's nothing wrong with using J-lube, but then remember, if anything happens untoward to that mare, you're probably going to have to kill her. Sharanne's spoken to you about oxygen and resuscitation. I agree. You guys are normally pretty good at that, and please don't hesitate. If you're not sure, between 5 and 10 liters of a minute of oxygen, set it up on your the meter here so that you can just turn it on here and then put the tube into the nose of the foal. And if the foal gets too aggressive and throws it out, then it probably doesn't need oxygen. And keep remembering our zoonoses. So zoonoses are diseases that can get transmitted from animals to man, and those are the two that are kind of sit on the top there, but there's also Salmonella, there's Coxiella, and we could just keep going on forever. And by planning, hopefully it means that we don't panic. And the other thing that we need to remember, if we are going to anesthetize mares on farm to assist with the foaling, that we need to have some way of lifting them up. There's no point in anesthetizing them and not lifting them up. I had to do that once in the flu outbreak because we didn't get anything. There was nothing there, and it was just a waste of time. All we did was got lots of gravel bruises and damage to the individual mare. So this is, I think, one of the best I've ever seen. It's a very lightweight, very robust system. Goes on wheels. You can bring the mare to it. It's got a pulley on it. This has also got a little battery holder. It's got lights on it. You can put the lights on and everything lights up wherever you are in the field. And most animals recover really well in the field. They don't end up slipping all over the place. I don't want to go too much into the actual foaling process. That can be for another time, but just making sure that we know what the difference between a normal foaling and an abnormal one is. And like Sharanne said, if it's normal, you probably don't want to go there too much. 2 feet nose lever to get on with it. Just watch them. But if there is a problem, then you want to be in there quickly. Making sure you've got, when the foal comes out, that you've got an assessment plan. I've got umbilical clips here because they were in here. I don't know what anyone thinks about umbilical clamps, but unless the foal is gushing blood, I think umbilical clamps are not to be used. They're just another nidus for infection. And then making sure we've got whatever it is that we're going to use, and chlorhexidine with alcohol is probably at this stage, to the best of my knowledge, the best agent for putting onto an umbilicus. And try not to put your hands onto it because most hands are a little bit dirty. And then afterwards, we all know about dealing with the foal afterwards, making sure that she's got sufficient colostrum. And Sharanne said that, and we keep telling people about colostrum. Thoroughbred industry in particular is, if there's one really, really good thing about the thoroughbred industry, is that they tend to now be really good at colostrum management and IgG status afterwards. And that's because of driven by insurance. And there's a good reason for it. And then I guess the other thing is trying to prepare for the next foal once the first ones come out, because there's always, we don't want to normally just stop at one foal. We want to carry on with the next foal. And here, what I'm trying to say is make sure you're thinking about rebreeding, even when it's just coming out, and my favorite drug for brood mares is oxytocin. And I think there might be a debate as to whether where the benefit may or may not be, but it's pretty innocuous. It's really cheap. And if you administer oxytocin at least twice a day to a mare for the first 3 days post-foaling, you are probably going to help her clear out any debris that's in the uterus and get her ready for ready for post-breeding as early as you can. Took a long time, kind of fell over my words there. And why not do foal heat breeding? I get the reasons why they're foal heat breeding, but I'll also go, guys, there's a really good reason to be foal heat breeding. Again, the same study by David Hanlon in New Zealand, and these have been published, and he's not the only one that's done it, but the sooner you get them ready for breeding, and I get it, we've got to have the right criteria. They've got to be young mares. They've got to not have any dystocia, no other problems associated with it. But if they meet those requirements, my view is get them to the breeding barn after as soon as possible after day 10, assuming they've got the right follicles. And there's the proof of the pudding. 86% pays 79%. You end up with 6% more mares in foal at the end of the season. Very similar to putting them under lights. And they tend to be early as well, because remember, if you don't serve them here, we've got at least a 10-day period while they're cycling before we can short cycle and bring them back.
Allan, you mentioned about the swabbing of the umbilicus, and are there benefits of doing multiple, say, sprays of that in sort of days after foaling, or not?
I haven't looked at the evidence closely, but certainly I would say doing it until it's dry is probably beneficial, but as long as you try not to touch with your fingers, because I think that's part of the problem. When people have dirty hands and they try and get this umbilicus and then they hold the umbilicus and then they try and dip it, I think that's probably more detrimental than if you just stick it into some hexadine and alcohol and let it be scooshed around that way. I don't think it's harmful to do it more often, as long as it's done aseptically. So I would suggest at least twice in the first 24 hours. After that, I'm not so sure about the benefits. I don't know if anyone's got any other ideas. There's Jen and Wendy, if she's got any ideas on that one. No, that seems to be, I think doing it twice is a really good thing. If nothing else, when you go and look at it for the second time, it makes you look at that umbilicus again to see if there's a potential problem. And I think sometimes the benefit isn't necessarily actually doing the disinfecting, but looking at it. So if you did it for 3 days and then this umbilicus is getting bigger because you've been forced to look at it, then I think that's probably the biggest benefit from it. What do you think on that, Sturt?
Oh, look, I think so too. We do tend to just use a spray bottle on them post, the couple of days post, depending on, as you say, how dry the umbilicus has become. But the other thing I was just going to ask was just back on the oxygen. Are there obvious signs where, I mean, obviously if a foal's not respirating correctly, it's pretty obvious, but as far as the use of oxygen is concerned, are there sort of parameters there where you'd say this foal is definitely going to benefit or this foal is not going to make it if he doesn't have oxygen? Are there those sort of ideas?
Yeah, so the other thing, just on the disinfecting, I think it's quite useful if you do it for 3 days and you administer your oxytocin to the mare at the same time, so the mare and the foal get given oxytocin and it's disinfectant at the same time, I think is potentially beneficial. With regards to the oxygen, I don't know. As far as I'm aware, the way that we administer the oxygen through the nasal insufflation just on the field, it can't do any harm. There's no such thing as oxygen toxicity under those circumstances, is my understanding. So and I don't think we know whether if we gave it oxygen, it survived. I think we know better if we didn't give it oxygen and it died. And if it's not going to cause any harm except maybe an excoriation of the nasal mucosa, then to me, it's a no-brainer. You put the nasal oxygen in and you leave it for a couple of minutes. And if it doesn't shake it out, then you probably did the right thing and you should keep it there. If it does shake it out, you may have not needed to have oxygen go in there, but it doesn't matter because it hasn't done any harm.
Allan, is that inserting the tube into the nose, or just putting it at the tip of the nose? I've never managed to keep it just at the tip of the nose. So I normally try and put it on the bottom of the nose and push it in about 15 centimeters so that it's actually sitting inside the nose, round about the back of the nasal cavity. And that way you know that the oxygen's definitely going into the nasal cavity and it's going to be breathed in. Yeah. And that's at a rate of 5 litres per minute, yeah?
Yeah, and I stand to be corrected by this, but between 5 and 10. So I think the number is, for some reason, I think the number is 8, but between 5 and 10. What I used to do is just make sure it was, every now and then I'd go past the oxygen and just turn it on at the big black button. And if the little ball went up to about 8, then I knew that it was set correctly. And I think that's much easier for stud staff to do. You set the meter at about 8 liters per minute, then turn it off on the black button. So when you're busy trying to do it and you're dashing to try and get it into the foal, all you have to do is turn the black one on and you know it's going to be at the right volume. And then after a couple of minutes, you can go and check that it is between 5 and 10.
Allan, Andrew at Twin Hills, with a foal that's crashed or is crashing, is it worthwhile having, if you haven't got a resident vet or a vet close by, having adrenaline or any other drugs in your kit, crash kits?
I was fortunate enough to have, I was a classmate of Kevin Corley, who at one stage was the guru on foal resuscitation, rehabilitation. He's still involved. And he came and gave us a talk in the Hunter once when he was doing a locum there. And if there was one drug that was going to be of any use, it's adrenaline. So yes, if you're going to keep anything else on board, it would be adrenaline. The problem is, how do you get it into that foal when it's crashing? So IV's the best way if you can do. The next way is straight into the heart. That's not necessarily ideal, but if it's going to be dying anyway, you may as well try going into the heart. I wouldn't advocate doing that as the first line of attack. Another way is to, apparently, if you squirt it up the nose, you're going to get a good enough absorption as well. But make sure when you've got the needle on it, you don't squirt the needle up the nose as well. But I guess that can always be got out another way. So if you are going to have any other drug, I would be going, yes, adrenaline.
Okay. And that's for foals that have got a low heart rate, or what's the best, like what scenario are you going to be using it?
Yeah, I think it's definitely with a lowered heart rate and maybe an increased respiratory rate if it's trying to pant, or if the respiratory rate's got too low. I think sometimes, again, I don't think a mil of adrenaline is going to cause too much harm. It might make its heart rate go a little bit high for a while, but most of the time, I think you get it, by the time you've looked at it and you find, oh, that looks like there might be a problem, and you've gone to find the adrenaline, you crack the thing open and you've drawn it up, you'll be able to tell whether you should continue giving the adrenaline or not. Would that be a fair comment, do you think?
It's just nice to think you've done everything you can.
Absolutely, I agree. I think, and it's not just doing something because we can do it, but it's doing something because we can do it and it's likely to be useful. And my understanding is oxygen and adrenaline. So I guess it's a little reminder, don't give adrenaline if there's no oxygen, because you can then make it, the physiological balances of the foal could then end up make it worse if you didn't have the oxygen going into the nose.
Okay, yep.
So you've got to have oxygen in there before you think of adrenaline. Cool. So the last bit, and I think we're running pretty much on time, Jen. So that's cool. Jen's going to talk to you about semen. Jen is a specialist theriogenologist who started her specialist training here at CSU. It seems like just the other day, but it was a wee while now, as we've all moved on in time. She's been all over the world. She's worked in the States and has worked in the Hunter Valley. She's now come back to join us at CSU, and before she became a vet, she did her PhD in semen. So she's certainly well qualified to talk about semen assessment. So thanks, Jen.
So we've talked about foals, we've talked about mares, but of course the other really important aspect of reproduction in horses is going to be the stallion. Remember, he contributes 50% or thereabouts of the genetic material to our combination to actually make our foal. So when things go wrong with him, we sometimes want to be able to troubleshoot some of those problems to see if we can try to increase his fertility, but also to identify that he is actually the problem if he is the problem in that scenario. So. So anyway, I thought I'd start with one of these like memes that are getting around the internet these days, like what people think I do versus what I actually do. You know, the reality is always a lot different to what the nice, pretty view that we try and put out in our brochures of looking very clean and intense and interested, when the reality is sort of standing underneath a stallion, trying not to get struck in the back or sort of ending in a somewhat bloody mess at the back of a mare that's been anesthetized for a dystocia. So I really enjoy my job. I get to do a huge variety of things, and I guess that's the best thing about being a theriogenologist, is that we're in the creation business, but it really starts with us in terms of looking at these mares and looking at the sperm, and then ends with getting a nice product at the end, a little foal that's running around on the ground. So sort of coming around about the middle of September, the second or third week of September, is when I start to expect those phone calls. Hi, Jen, I think I've got a dud stud. So the middle of September, you know, we've got our new stallions, or maybe even some of our older stallions that have been really good producers for us over a number of years. And we get to that period of time when we get really excited to go and get our first pregnancy results, and there's nothing there. And then the days go on, and more mares come through the crush, and still there's nothing there. And so, of course, we hit all of the panic stations at that point in time and want to try and work out what's wrong with our stallions. Now, could we be doing something about that before? And of course, the answer is yes. So troubleshooting the stallion is often something that we could have actually prevented in the beginning if we had a look at the stallion before he started serving and tried to work out what exactly might be best for the stallion going forward into the breeding season. So I thought I'd run through what we would do in a normal stallion assessment. So obviously the stallion assessment is going to look at everything, not just the sperm. So we want to make sure that when we do a general examination that we're looking at the normal anatomy of the penis. We want to make sure that we palpate and ultrasound the testes. We want to make sure that there's no lumps or bumps in the system, that the testes look normal in terms of their on palpation, that they've got a normal size and normal architecture. But the other really important thing is the general health of the animal. And it's important for me to know if he's gone through any issues prior to the start of the breeding season, because that can ultimately impact on his fertilizing capacity coming into the breeding season. So the next part of what we would be doing is a serving capacity test. And we usually do this. There's a number of studs that will do a couple of serving capacity tests prior to the breeding season to make sure that the sperm that then goes into the first mares from the 1st of September onwards is actually going to go ahead and achieve fertilization. So during these serving capacity tests, what we want to see is good libido and good behavior of the stallion, suggesting that he's actually up for the task and that he's fit and willing to do so. We need to be able to observe that he can achieve a normal erection and achieve intromission in the mare, and then importantly ejaculation. There's a lot of stallions out there that are really good at faking it, and so we believe that they've ejaculated when in actual fact no sperm has gone into the mare. And if you don't get a sperm in the mare, what I've learned in my extensive years of study is you can't get a pregnancy. So we do actually need some sperm in there to be able to get a pregnancy. So some of the other things that we might do with our stallion assessment are swabs of the urogenital tract to make sure that there aren't any, there's no evidence of any sexually transmitted diseases. And we also may perform bloods for hormone analysis. So one of the cool things about stallions is that they weren't really designed to live in groups if they were all supposed to be breeding brood mares. So that we have what we call harem stallions, so those dominant stallions, versus what we call bachelor stallions. So those less dominant stallions, they're a little quieter, sometimes behave a little bit more like a gelding. And interestingly, the harem stallions can produce large amounts of testosterone, and they can reduce the amounts of testosterone that are in those other bachelor stallions. So sometimes we might need to look at implementing some environmental effects with the stallions that might help them to have better cervic capacities tests going forward in terms of increasing their libido and normal stallion-like behavior. So they're just the basics of the stallion assessment tests, and these are basically the things that we want to make sure that we get right before we start the breeding season. But the next component of that would be a semen analysis. Now, if you've got a first season sire, a semen analysis is not allowed as part of, if you've got that stallion insured for first season sire insurance. But in other stallions that have been in breeding programs before, sometimes it's good to know what you've got before you go into the breeding season. So a semen analysis, we've got a very basic semen analysis. Basically, what we want to try and assess is whether there are sperm in the ejaculate and whether those sperm are alive. And then we need to try and determine whether they're capable of fertilizing. And unfortunately, the best way that we can determine whether a stallion is fertile or not is to actually go ahead and breed mares. But there are a number of different analyses that we can perform in the laboratory that can give us some clues as to whether that's going to be possible, and also so that we can adjust the number of mares that stallion is capable of breeding over a day or over a week or over a month, but also whether that stallion may need to breed certain mares multiple times or within a close period of time to ovulation. So we can do our basic semen analysis, which involves looking at the volume of the ejaculate, the concentration, so the number of sperm cells that are within that ejaculate. And then we can do what we call a subjective motility analysis, which just means that I subjectively look down the microscope and say there are X number, so 50%, 70%, 80% of those sperm cells that are there under the microscope that are moving. A CASA analysis is a little bit more sophisticated. It's what we refer to as an objective motility analysis, and we use a computer to do this. So I'll show you a video of a computer assisted sperm analysis, and what it basically does is this computer picks up each individual sperm cell and it determines whether it's going in a forward progressive manner. So it's not circling or going sideways, it's actually heading off in a straight direction, and some other motility parameters as well. And it also has the benefit of having a video that can be attached to that stallion's file, so we can see over the breeding season whether he's changing or whether he's improving in terms of his motility characteristics. Now, motility itself is not a great indicator of fertility. However, if you don't have any motile cells, your chances of actually achieving a fertilization is pretty low. So the next part of the basic semen analysis would be the morphological analysis. We get a lot bogged down on morphological analyses quite frequently. What we want to try and see is whether there's a significant proportion of defects identified. So our normal sperm cell has a head, a midpiece, and a tail, and then lots of aberrations can occur within that cell type. So some of these problems with morphology, so a bent mid-piece or tail defects or head defects, can contribute to subfertility. And we can also assess these defects over time. So I mentioned earlier that the general health of the animal is really important. So if he has, for example, a fever coming into the breeding season, a fever can be quite detrimental to sperm production. The testes are a very sensitive kind of area, as I'm sure you've seen with a stallion that's in a hot climate. His testes will hang quite low. When it's a little cold, he'll hide them up next to his body, and temperature regulation is really important. So if we have a stallion that has an elevated temperature because he has an illness of some description, he's unable to regulate the temperature of his testes, and that can often present itself with poor quality sperm in his ejaculate. And the biggest problem with that is that it actually can happen for up to 6 weeks after that initial insult, because the sperm cells that come out and are fertilizing our oocytes during the breeding season, they actually started being made in the sperm factory 6 weeks before. So it takes a long time for us to actually start to see some of those problems and defects that come through the system. So we may end up having to sort of shift the breeding season for that particular stallion in terms of his fertilizing capacity if he has had some kind of an insult to his system. The other thing that we can do with a basic semen analysis is sperm longevity testing. It's important to note that this is an artificial stress test, but what we're trying to do is add sperm cells to a commercial semen extender, commercial horse semen extender, and then determining how long it takes for those sperm cells to die. In a normal fertilizing stallion, we want them to be able to survive for a reasonable period of time. So in a live cover situation, we normally expect sperm cells to live within the mare for 48 to 72 hours. Now, that's not always the case for certain stallions, and certainly our stallions that are serving a significantly higher proportion of mares, they may start to have reduced longevity of their sperm cells. So this artificial stress test helps us to determine the timing of ovulation of our mares with respect to inseminating. So if we've got a stallion that only has that most of his sperm cells, so the sperm cells have less than 10% total motility after 12 hours, then we would need to make sure that those mares ovulate within that 12-hour period to try and achieve the best fertility for that particular stallion. So I've joined forces with what we call breed diagnostics, which is actually a branch of the Newcastle University team, which have been doing a lot of these advanced sperm analyses for horses over the last couple of years. Those of you who are in the Hunter Valley, I'm sure you've heard of these guys, Amira Gibb, John Aitken, and Aliona Swedgen, and then I'm a consultant with that particular crew as well. So they also provide an independent semen analysis, but they also, so not only are we able to do one of those basic sperm analyses to try and just make sure that we tick all the boxes, we've got adequate volume, we've got adequate concentration, we've got adequate sperm cells that move, and they will last for an adequate period of time within the mare's reproductive tract. We can actually do a number of other tests, especially if we've got a stallion that may be having some problems. So some of those tests will include not only just the routine longevity test, but looking at some flow cytometry. So we basically put a whole bunch of cells through a specialized machine, and it can determine how viable those cells are. So whether they're dead or dying, or whether they're alive and good to go. We can also assess the DNA damage, and that's a bit of a hot topic. I'll explain that on the next slide. So what those sperm cells look like when they come out of the sperm factory, and then how they survive and are tested within the mare environment thereafter. And then acrosome integrity, so the actual functioning of the sperm cells. So even if we've got a good sperm cell sitting under the microscope, it doesn't necessarily mean that it's able to go on and perform all of the functions. And realistically, it amazes me every time that we actually even achieve a pregnancy, when we have to ask these sperm cells to do so much in such a small little package, and they have to go through a number of processes. So they have not only do they have to be ejaculated, they then have to swim up to the uterotubule junctions, they need to move into the oviduct, they then have to bind to the oviductal epithelium, undergo a process called capacitation, then be released, then they have to find the oocyte, then they have to try and bind to it, undergo this thing that's called an acrosome reaction, and then burrow into that cell and ultimately result in a conceptus or an embryo. So what we're basically doing is breaking down each one of those points and just trying to see if there's a problem in each one of those areas. So in terms of DNA damage assessment, we've got 3 different types. We've got what's called a sperm chromatin structure assay, a halo, and a comet. Now, all of these are basically looking at DNA damage that's coming from those sperm cells. We do actually mix them with a number of substances, and we see whether they fragment. So in the SCASA, or the sperm chromatin structure assay, if we see DNA fragmentation of more than around 25%, it usually tells us that there's a subfertility issue. With the halo, you can see on the side here, these big, large halos indicate less DNA damage, these little ones, more DNA damage. So again, those sperm cells have been stressed with some oxidative stress problems to see how they behave in that situation. And we can determine whether their chromatin, so the DNA that's compacted inside those cells is actually normal and can then go on to actually result in fertilization and what we call syngamy, so where the sperm cell DNA meets with the oocyte DNA. And then the third one is a COMET assay. And the COMET assay actually looks at what DNA damage comes out of the stallion. So this one is looking at any damage that may have been caused in the normal processing plant. And then the other two are looking at the DNA damage that can happen to those sperm cells once they're out of the testes and out of the epididymis. So in terms of their fragility, I guess, once they're outside and in the mare. So these DNA damage assessments are really important. We certainly see DNA damage occurring in older stallions, but also ones that are under stress, and particularly if we've got a case of testicular degeneration, which tends to happen more so in our older stallions. So DNA damage assessments have certainly become commonplace, particularly in significant subfertile stallion populations. How are we going for time, Alan? Good, we're still pretty good. All right, so What if everything looks okay? So sometimes we can go through all of these processes and, we can tick off our concentration, we can tick off our motility, we tick off that the acrosome reaction is happening normally, it's undergoing capacitation, it has normal DNA integrity, there doesn't appear to be any DNA problems that could cause, a misfiring of that fertility issue. But the ultimate problem with these stallions is that they still have no foals on the ground, and that's obviously the aim of the game when it comes to equine breeding. So I just wanted to run through one example, well, two examples actually, of what we can do to further investigate some of these problems. So we can do a number of different tests with the stallions, but this is taking it a little bit further when we really start scratching our heads and want to try and get to the bottom of a significant problem. So this is a thoroughbred stallion that we looked at a number of years ago. He served a number of mares and did not achieve any pregnancies. So what you'll see in the video is that he has excellent libido, he has excellent behavior, his general health status was absolutely fine, he didn't have any problems leading up to the breeding season. He served mares normally. As you can see, he gets a normal erection. He's pretty good in that kind of department there. And he is a thoroughbred, and we were able to train him to collect off the dummy because he had such great libido that he didn't really mind that he mounted this inanimate object over here. And as you'll see, we'll do a semen collection on him. So what he was looking at there was the teaser mare, and he's pretty vigorous. He's sort of throwing me around a little bit there. But in a moment here, you'll see his tail flagging. There he goes. So that's his tail flagging there. He's ejaculating, and at this point, I guess I'm a little worried he's about to fall on me, but I think everything seems to be okay once he regains consciousness. And that's one of the ways in which we will do a semen assessment. And you can see that collecting off the phantom is actually a far safer option for us as veterinarians rather than including an additional horse into the mix. So this guy was the 5-year-old thoroughbred stallion that's on the left-hand side. He covered 72 mares in his first breeding season, and he achieved 0 pregnancies. And then we found another one that same year. He was a little bit different in terms of his presentation. He was a 10-year-old stock horse stallion. He covered around 25 mares, so we're talking a very different number of mares that he covered, but he too achieved 0 pregnancies. And so importantly, we did this basic semen analysis. We thought, well, we might as well just check out his sperm, make sure that everything's okay. And so both of these stallions had adequate progressive motility. They both produced adequate numbers of sperm to achieve a pregnancy. Our sort of magic number is 1 billion progressively motile and normal sperm in each ejaculate. They both had more than 70% normal, morphologically normal sperm. So none of them had bent tails or bent mid pieces or abnormal heads. And then we just had slightly different scenarios with them. So we tried to breed the thoroughbred stallion within 6 hours of ovulation, with including cross covers. So he bred mares multiple times to try to achieve a pregnancy, whereas our stock horse stallion was a little bit more limited in the number of mares. Also, he didn't have to breed a number of mares, and I think his owners probably got a little bit bored with trying to get him to breed because they weren't actually achieving any pregnancies. But he was, so artificial insemination was used with that particular stallion just to make sure that, you know, the goods from stallion A went into the mare B and at an appropriate timing, and still 0 pregnancies were achieved. So this is the semen from the second stallion. And as you can see under the microscope, everything looks great. So this is a computer assisted sperm analysis image. And basically what it does is it gives us a visual impression of what the sperm look like on the screen. And it tracks those individual cells, determines whether they're going in a forward progressive manner, so they're actually heading off and going somewhere important, or whether they're circling on the spot, or maybe even going too far sideways instead of going in a forward direction. But as you can see, this stallion's got exceptional sperm, and which is why it had us scratching our heads trying to work out what on earth was wrong, because everything on paper looked great. So at the University of Newcastle, we referred him for advanced sperm assessment, and we went through a lot of those procedures that I've gone through before. So we wanted to see whether those sperm cells had significant amounts of oxidative damage. So oxidative damage can happen because of the metabolism of the sperm cells, also can happen within the testes as well. So we wanted to make sure that these cells weren't coming out damaged and weren't becoming damaged quite quickly after they were outside of the testes and the epididymis. We wanted to test whether he had any DNA damage as well. We wanted to make sure that his acrosome was functioning properly. We wanted to make sure that the cells were undergoing normal capacitation. And then the final part of the puzzle was also to check whether they actually did find an oocyte and bind to that zona pellucida, which is the outside layer of the egg itself. So, of course, he passed all of these sections with flying colours. So we moved him on to that zona pellucida binding assay. So in the next slide, you'll see this is what happens with a fertile control. So I developed this technique when I was doing my PhD. We actually use bovine eggs, so eggs that have been taken out of cows. And it turns out that stallion sperm don't really have a preference. They still like eggs, regardless of what species they come out of. And so what we're then looking at is having a look at this percentage of sperm, or the number of sperm that are bound to those oocytes. So you can see it under normal light microscopy on the left-hand side, and then we use a fluorescent dye that just makes those sperm cells look nice and bright and blue, and it just makes it a little easier for us to actually count the number of sperm. And we can see with the fertile control in this particular situation that we had an average of 85.2 sperm bound to each egg. When we had a look at our infertile stallions, they had an average of 3 to 4 sperm per egg. So you can see that there's a bit of a problem going on in this scenario. So we had a failure of zona pellucida binding. And one would assume that this is quite an important procedure if you're a sperm cell. You really need to not only get through the uterus, get through the uterotubule junctions, bind to the oviductal epithelium. Then when you find that egg, you need to be able to bind to it, and you ultimately need to be able to penetrate it. Otherwise, your DNA material will never meet up with the egg's DNA material. So some people that are much cleverer than I am is, wow, that was good. They did some proteomics, and they were given some clues from other species first. But what was really interesting is when we looked at fertile stallions, we have fertile control stallions, and when we compared them to our 2 infertile stallions, we saw that with this protein here, which is called ZPBP, you can see that the brown column is significantly less than the green column on the left-hand side. And this ZPBP stands for zona pellucida binding protein. So this is a protein that's really crucial in terms of actually, if you're a sperm cell and you want to bind to an oocyte, you need to have this protein. And in other species, it has resulted in complete infertility if that protein is absent. But at this stage, we hadn't characterized whether the horses had this particular problem as well. So we then used that zona pellucida binding protein. We had a special fluorescent binding protein that would target that protein itself. And so you can see that on the fertile control stallions, we can see in the acrosomal area of the sperm cell, so that little hat on the top of the head, we can see that they're fluorescing nice and brightly when they have zona pellucida binding protein. And then when we had a look at our infertile stallions, we had no fluorescence. So we could identify that these stallions did not have the presence of this zona pellucida binding protein. And the result was that this was a nice novel cause of infertility in these particular stallions. Now, I guess the thing to note is that obviously these stallions are outliers. There aren't a lot of them around, but there probably are more around than what we realize. And without investigating them, it's really hard to identify them. So I guess I just use this example to show that although our sperm analysis and our stallion exam can usually identify the majority of the problems that might happen with our stallion and how we might be able to manage him going forward into the breeding season or to try and improve his fertility, there are sometimes things that we cannot control. So with these particular stallions, they had an inability to bind to the zona pellucida, which means that they were never, ever going to be able to achieve a pregnancy in the broodmare. Now, we could circumvent this with doing things like IVF or ICSI, where we pick up the sperm cells and we shove them straight into the oocyte and create an embryo. But I guess we probably need to start thinking about whether we actually want these stallions contributing to the reproductive population in the future. Anyway, that's all I have to say about that. There's obviously more research to come. We'd like to find more of these stallions. They're not very useful in terms of reproduction, but they're very fascinating to study, and hopefully we can overcome some other problems with some subfertile stallions by getting more information out of them.
A situation where mares are being covered, haven't been cas-licked and taking a fair bit of air as they're being covered. What is how does that affect the viability of the sperm? And obviously that mares like that will need a cas-lick, or they may need post-treatment, post-service treatment, but really I guess just what effect does air have immediately at service time?
I'm not usually worried too much about air right at the time of service. The way that the stallion ejaculates into the mare is reasonably unique. The belling of the penis kind of basically blocks the cervix and allows that sperm to be directly deposited into the uterus. Now, if that mare has been uncas-licked for a number of days and has been aspirating a large amount of air, not only into her vagina, but also into her uterus, then I would be more concerned about the uterine health and an endometritis, so an inflammation of the uterus because it's being irritated by that air that's actually in the uterus. And that itself can set up more of a hostile environment for the sperm cells. So in those particular circumstances, as long as I've ruled out an infectious cause of endometritis, I normally try to ensure that those mares are only uncas-licked at the time of service if I can. So we can take swabs through speculums. They routinely do it in the Northern Hemisphere because every mare on the track is cas-licked within an inch of her life. And so the only way to actually do a swab is through a speculum, opening the cas-lick at the time of breeding and only opening it as much as required. And then potentially even performing a uterine lavage prior to cover to ensure that we try to sort of mitigate some of those issues or the hostile environment of that uterus to make it so that it's nice enough for those sperm cells to survive. Now, in general, those sperm cells actually aren't in the uterus for a particularly long time. So we often say somewhere between 30 minutes and 4 hours that they're safe on the other side of the uterotubule junction, and then we can start lavaging the uterus to try and make it ready for the embryo to come down. So there's a few things that we can do before, a few things that we can do after as well in those mares. I guess the other point that I wanted to make too is that if those mares are really aspirating a large amount of air at the time, teasing can be quite useful to make sure that they're always sort of tipping themselves up and pouring out the urine so that they're not aspirating any kind of urine up into their uterus. But also There are a number of other procedures that can help to restore the perineal body. So we've got the anus, and then we've got the perineum, and then we've got the vulva. And sometimes actually restoring the architecture of the perineum may help to correct the vulva itself, so that we have less of a problem with them aspirating air going forward. And I would recommend that happen much earlier in a broodmare's career, rather than us trying to sort of fix a problem that's been a problem for a long period of time, just so that we can increase her reproductive career going forward. Does that answer the question?
Hi, Jen. Andrew at Twin Hills.
Hey.
Is there benefit in swabbing first season stallion that hasn't been sexually active yet? Is there other things we're looking for, non-sex?
Allan might want to chime in on this one. I don't think there necessarily is. I guess the problem is that with any, I mean, we certainly see some organisms present in maiden mares, and often it's because they've gone through some stress periods in their time, and they end up with significant populations of certain bacteria in certain areas. But I don't really see the need or what we're necessarily going to do with a swab from a maiden stallion. Klebsiella is going to be unlikely, but only because I've never seen it, but I don't know if Allan has.
No, it depends what you're wanting to find. It depends on your reasons for swabbing it. So if you need to swab it because you're going to send it somewhere, then obviously it's worth it. If you're trying to swab it to see if you can find a problem, my suggestion would be don't go looking for the problem, because it's a maiden animal. And we have to assume, unless you assume or think that it's not maiden, so it may have gone and bred mares wherever else that he may have been, whether it was at the racetrack or on a quarter horse farm or wherever it is. Yeah. But I would say that the benefit of swabbing a stallion without any obvious problems would be a waste of resources.
And what about maiden mares, uterine swabs on maiden mares? Is there any benefit of the unbred maiden mares?
I mean, I guess the thing to remember is that, you know, a maiden mare has gone through a phase in her life where she's done a lot of growing. And quite often, if they've gone through phases where they've had not quite a lot of musculature on their hind end, they may have been aspirating air and urine and anything else that happened to be on the outside, on the inside. You know, I think it's always possible to have a uterine infection in a maiden mare. It's uncommon, but it's possible.
Okay.
Yeah, I'll come in on that as well. I think that generally, and this is the general as Jen alluded to, I think you're more likely to be detrimental than beneficial in doing a maiden mare uterine swab. I think you're better off getting semen inside her and then tracking her with other means. And if there's any other reason why you think there might be a problem, then use it then go to the taking a swab. I think being proactive is good, and I think doing nothing is sometimes the best proactivity.
That'd be possibly introducing something.
Correct. Yeah.
Thanks.
There's always, every time we go into the uterus, there's always a possibility that we will transfer something else in there. Whether that be a stallion or whether that be a human.
And so it's that cost benefit, isn't it? If there's no reason to suggest that we should go swabbing her, then why do we do it? If you've been scanning her and you've seen fluid in the uterus, as an example, two or three occasions, you might go, this might be worth doing because there's some other factor, or you know, if there's anything else that she's got a poor perineal conformation, as Jen alluded to, something else that suggests that it might be beneficial, then do it. If it's not, I think. And I feel quite strongly about this, for probably 99-point-something percent of mares, I think you're doing them a disservice by swabbing them as a maiden. I don't know what you think on that, Jen.
I think in most cases it's unnecessary, but like you say, clinical judgment's important, and unfortunately we often
standard protocols.
we have to play by the rules, exactly. I guess the only other benefit is that I feel like I'm more gentle at breaking down a hymen, and it gives me a chance to palpate her cervix so that I know that she's actually good to go, because sometimes their behavior will not give us a great indication that she's ready for cover.
Thank you.
Cool. Well, we've got to midday. It looks like, has anyone got any more questions, or it'll be 2 o'clock for those across the ditch. Thanks for joining us. Anyone got anything else to say? Comments, questions, queries? It's been, I've enjoyed this. So Sturt, thanks for pushing on this. Jen, Vicky and Sharanne, thanks very much for taking part. I think it's been really good. And to all of you guys out there, she's not on anymore, but and I've forgotten her name now. She's just gone. Lady from Thoroughbred Breeders in Scone. Julianne, that's it. Julianne, thanks very much for also coordinating all these kinds of things. So thanks very much. And I hope you guys have enjoyed it. And hopefully we can do it face-to-face in 2022.